The largest series is from the Mayo Clinic of these patients, and they demonstrated that I believe it was about 22% had a evidence of a second event. In many cases, we actually will see when we do an angiogram or a cath that there was another vessel that had this happen to it, which perhaps was just completely silent. We don't know, though, if that number is really going to pan out, that 22%, because we really need to have a larger series. Really, it would be most helpful if all of the centers around the United States and Canada could pool their patients, and even Great Britain, and have like a number like over 1,500 or 2,000 patients, so we could really know for sure. When they present, we have to make the correct diagnosis, and a big part of the work that we're doing is to better educate nurses and doctors who work in emergency rooms so that they appropriately send these patients down the right pathway of testing so that it's identified. Then once it's identified, the majority of these patients are actually treated conservatively, so they don't have a stent, they don't have bypass surgery, and oftentimes the artery will open back up on its own if they're left alone and just treated with medications. There are a number of ways. First, blood testing, looking for heart enzyme or troponin leakage. Other testing would include an angiogram, a catheterization, or a CT scan of the heart arteries. And of course, an EKG, electrocardiogram. And echocardiograms are also helpful in showing whether or not there's any abnormality in the heart muscle function.
What we've been trying to promote is cardiac rehabilitation first, so that they get about 6 weeks of supervised exercise to kind of get back on their feet and whatnot. And then at that point, oftentimes we will end up seeing them, or a cardiologist should see them, to kind of slowly get them reintegrated back into their exercise. There's certain things such as heavy weightlifting and other things that we certainly don't promote, but we don't want these women to have to be sedentary for the rest of their lives, because exercise is such a big important part of most of their lives.
The other thing that we realized with this population is that they have an enormous amount of psychological distress associated with this, stress, anxiety. The majority of them, have young children, jobs, and spouse, and the impact of cardiac diagnosis is really profound, and so that's another reason why they need to exercise. And we also want to develop some other mind-body potentially therapeutic, components to the work that we're doing.
Actually, I think most of the patients we have in our cohort present with a fairly typical presentation, right? And actually the majority of them, or I would say about 50 to 60%, I should say, when you get an EKG on them, they will have a marker of a heart attack. So what we call an ST elevation myocardial infarction, meaning it's pretty pronounced heart attack on the EKG that you can see. So one of the important things is, I think, even if there's a woman that comes in with chest or back pain who doesn't have any risk factors, and a heart attack is very low on your differential, a simple EKG could potentially be life-saving. And so I think that's one of the things we're trying to promote, is that it's a simple tool, a non-invasive tool that you can use to reassure yourself that you're not missing something. Part of the reason why our centers focused so much on trying to recruit women into our registry and into our research is because we don't truly understand the underlying pathophysiology of this disease. And so it is, as you mentioned, very difficult to give recommendations because it's a relatively new condition that we're still in the midst of studying. So I think part of it is the importance of recruiting patients into our study and into studies across the nation and across the world, so that we can get a better understanding of how to treat these patients and what management advice we can give these women.
One of the things that we are trying to do really is to help develop better diagnosis pathways, and I think that we realize, certainly as we understand more about the genetic basis of this condition and other sub-conditions that may be associated with it, we'll have the opportunity for development of potentially drugs and therapies. But right now our big issue is that these women are still being sent home from the ER. And so I think the education piece is one that is really where we're putting a lot of emphasis as well, to identify the cases, to see how they were managed, and then to try to learn from the lessons that we've seen and really try to improve that care overall.